Hospital, one of the oldest and most trusted private hospitals in the country. Amongst the many super specialty disciplines in the hospital, one of the most sought after is the unit of IVF. The center provides IVF to more than 1,500 couples annually. With the incorporation of newer technologies and rigorous persistence with quality control, the center has achieved high success rates comparable with international standards. Indeed, the center has been currently ranked as the best IVF center in Delhi NCR and North India, and the second best IVF center across India. What is IVF? IVF, or in vitro fertilization, refers to the process of achieving fertilization between a sperm and an egg in an IVF laboratory and placement of the resulting embryo into the uterus of the mother. This process is also commonly known as test tube baby. Usually, IVF is undertaken in cases of blocked tubes, sperm defects in the male partner, or prolonged unexplained infertility. Before the start of an IVF procedure, the patient undergoes some pre-IVF blood tests to establish suitability for IVF. Thereafter, the patient registers at the center, where the couple goes through a counseling session with an IVF counselor. Generally, the IVF procedure begins on day 2 or 3 of a cycle, which involves an ultrasound and a few blood tests at the IVF lab. After which, ovarian stimulation is initiated with hormonal injections known as gonadotropins. These gonadotropins are required for growth of multiple follicles containing eggs. It is essential to take these injections daily at the prescribed time to ensure optimal follicle development. These injections are simple to administer and can be taken by the patient herself. This stimulation phase of the cycle generally lasts for approximately 8 to 14 days. Once the follicular stimulation is complete, a final injection for triggering ovulation is prescribed. This injection is usually taken at night, following which an egg pickup is scheduled 36 hours later. Failure to adhere to the time and date of this injection may result in the failure of the entire cycle. Egg pickup is a safe and minimally invasive daycare procedure performed in the IVF operation theatre under anesthesia, where eggs are retrieved through an ultrasound-guided needle without any surgical cut or stitch. This process doesn't require any hospitalization, and the patient is discharged after a few hours of the egg pickup. After egg retrieval, the male partner is asked to provide his semen sample for further processing for IVF. Processing of semen involves removal of non-motile or dead sperm, and only healthy motile sperm is separated for further use in IVF. Fertilization. During the process of fertilization, the sperm is added directly to the eggs kept in a petri dish, thus allowing sperm to penetrate the egg and fertilize it. Alternately, sperm may be injected into each egg in a process called intracytoplasmic sperm injection, or ICSI. All eggs that are inseminated or injected may not fertilize. On an average, only 60% of eggs that are retrieved are able to fertilize. Once an egg fertilizes, it produces a zygote the next day. Embryo development. Subsequently, the resulting zygotes develop into embryos on day 2. Not all embryos are alike, with some having better quality than others. The embryologist identifies embryos with good quality and segregates them from the remaining poor quality embryos that may be slow growing or fragmented or showing abnormal growth patterns. Embryos can be cultured from a minimum of 2 days up to a maximum of 5 days in vitro, depending on the number and quality of embryos available. Embryo transfer. Embryos may be selected for transfer into the patient on days 2, 3, 5 or 6 after her egg pickup. The day and number of embryos to be transferred is decided after discussion with the patient. Typically, only 1 or 2 good quality embryos are transferred into a patient. Embryo transfer is a simple and painless procedure that does not involve the use of anesthesia. The developing embryo is transferred into the female patient's uterus with the help of a fine soft catheter inserted through the cervix. The patient is required to rest for only 10 to 15 minutes after the embryo transfer. At the time of leaving the center, the patient is given a date for the pregnancy test and written instructions about medicines to be taken up till the day of the test. Embryo cryopreservation. After embryo transfer, any extra embryos remaining in culture can be frozen for future use. The technology used for freezing embryos is a very robust one, ensuring high survival rates after freezing. In case an embryo transfer doesn't result in a successful pregnancy, frozen embryos come in handy as they provide the couple with additional chances at conception without having to go through another IVF cycle. Embryo freezing is also a very good option in cycles where either the number of eggs retrieved is too high or the endometrium is found to be too thin or too thick on the day of embryo transfer. In such cases, it is advisable for all embryos to be frozen and embryo transfer to be performed in the next cycle to increase the chances of pregnancy.